One especially important Indian innovation has come in the area of heart surgery and how to run a hospital. The leader here is an Indian named Devi Shetty, who has worked near Bangalore as both a doctor and an entrepreneur. Shetty ran into the problem that most Indians actually cannot afford heart surgery at all. If you look around the broader world, especially in developing countries, most individuals cannot afford any major form of surgery at all. So he thought about, how can I make heart surgery and other surgeries in general cheaper without sacrificing quality? Shetty reorganized how hospitals are run based on some fairly fundamental economics ideas. One of these ideas is economies of scale, namely that the more times you do a procedure, the better you get at it, the more cheaply you can do that procedure, and the more readily you can monitor quality. So one of Shetty's hospitals, for instance, has over 1,000 beds, mostly devoted to doing particular kinds of heart surgeries, and in the United States a comparable hospital might have only 160 beds. Of course, that means that Shetty's hospital is larger. A related idea is economies of specialization, so it's not just that the Shetty hospital is larger, it's also that it is more specialized. A doctor does the same operation many times over, and again, this allows for lower cost and also higher standards of quality. Sometimes this has been compared to the more general notion of assembly line production, as is used to produce automobiles. If you look at a Shetty hospital in India, it is commonly the case that they can do an heart operation for less than 1/10 the US price at less than $2,000, and of course that allows them to bring heart surgery to many more Indians. Based on the money they have earned, they have also used this revenue to be able to give a lot of Indians heart surgery either for free or at greatly reduced prices. Overall, it's in some ways hard to compare quality because we have different groups of patients showing up at these Indian hospitals, but all the available evidence we have suggests that the Shetty hospitals have the same or better fatality rates compared to most other hospitals around the world. If you sum this all up, that's a really important innovation. What next? It now seems that Shetty is looking to set up a branch of one of his medical centers in the Cayman Islands. The Cayman Islands is about an hour-long flight from Florida, so it seems that a lot of Americans could travel to the Cayman Islands to use this hospital. The plan is that prices at this hospital will be less than 1/2 of the prices currently prevailing in the United States. This picture, by the way, is actually a symbol for the Cayman Islands, and it is, most appropriately, in the shape of a heart. To read more about this topic, Google Devi Shetty. There's plenty online. You can also watch interviews with him on YouTube, and also Google the word Jugad, an important idea for Indian innovation. Think of this word as standing in for some concept of frugal innovation based on constraints.